Okay, well, moving on. I was on a show this week called Mom Swipes Left. And it's two women, Jen and Carol from Maine. And they have a somewhat fanatical audience. They've got this guy that's a potato like Cardiff. Matter of fact, that's where Cardiff got the potato from.
Okay.
But he's a potato underground. And he does an after show to their show called Palm Swipes After. And then Cardiff started doing the potato because he would do an after show to Palm's after show, because Palm is just French for potato. Mm-hmm. And he would do Palm Swipes After, Palm Swipes After. And then he kept the potato, and then the potato became Cardiff Electric, and now everybody thinks of him as the potato. But the truth is Palm Swipes After was first. But anyway, fanatical fan. And I had a lot of fun on their show because they asked a lot of weird medicine questions. I mean, stuff that we used to get way back in the day, back when this show was really weird medicine before COVID ruined it and it became a little bit more serious. And I've been wanting to kind of get back to doing more dicks and nuts and that kind of stuff. And it was basically an hour of those kinds of questions. So it was a blast. And they were really funny, and I think more people should probably be listening to them. At least listen to my episode, which will be up.
Which would be awesome.
Yeah, which it should be up by the time you hear this. But anyway, so I said, why don't we do a bit where you guys call in every week, or whenever you have a notion to, and call in a weird medicine question. And we'll plug your show, and it'd be good for everybody.
Cool.
So it's, where did I put this thing? Okay, here it is. Here's their sweeper that I made this morning. It's very rudimentary, but it'll just have to do. It's time for Mom Swipes Left Has Questions with Jen and Carol from the Mom Swipes Left podcast.
Hey, Dr. Steve.
Hey, Dr. Steve.
It's Jen and Carol from Mom Swipes Left. We have a question for you. How common is it for a man to ejaculate with a little bit of blood in it? Like, is that a terrifying thing?
Wait. Pause.
Yes.
What?
One time, someone in my life ejaculated and there was a little bit of blood in it. It was
That
pinkish.
is nasty.
Okay.
Okay.
Let's not shame. I'm wondering.
Yeah, let's not hematospermia shame. I wanted to wait for you to be here since you and I have common interest in this question.
How common that is, because I would imagine that if you get like smacked in the nuts or you move a wrong way, there's a lot of blood vessels in your nuts and stuff.
Are nuts that sensitive?
I think they might be. That's what I'm asking you, Dr. Steve. How common is it for that to happen? Because most men ejaculate into a mouth or an ass or a pussy.
Oh, right.
In that
So you
order.
would never know.
Right.
Huh.
Thanks, Dr. Steve.
You're the best.
No, thank you. That's a great question. And Tacey, you know, God damn it, hang on. You got choked up because Jen and Carol. Hang on. Good Lord. We're never going to get through this.
Nope.
Okay. So, Tacey, you probably remember when this happened to me.
Nope.
Do you not?
No.
Wow. You really don't pay attention, do you? It's okay. We were in Jamaica, and we had.
Oh, I do.
Okay. Oh. Yeah. Now we were in Jamaica, and we had a session, if you know what I mean. And I noticed that there was some blood that was just sort of dripping into the turlet at the time. Mm-hmm. And that's when I ended up having to have the fiber optic scope.
Yes.
So it is called hematospermia. Dr. Scott's had it too. Is that why you had it? Did you have hematospermia? Why did you have the scope done?
Well, prostatitis.
Okay.
Yeah, just to rule out any kind of prostate or bladder cancer. Yeah, but I certainly probably had some of that too.
Yeah. The good news is that the condition is usually benign.
Yes.
You would think blood in the semen would be a sign of something bad. But you do have to exclude the bad things first.
Yep.
You do a physical exam, you do some laboratory eval, and then every once in a while you get the old fiber optic tube shoved up your urethra.
Sweet mother of pearl.
Now, what my friends are telling me who have had this more recently.
Uh-oh.
Uh-oh.
Amber
Amber
alert.
alert.
Yep.
Okay. In another city altogether, so I hope the kid is okay.
Heck yeah.
The urologists are a little bit better about doing these things than they were when you and I did it, because when you and I had it done by the same guy, and it might have just been him.
It might have been his technique, I'm thinking.
Yeah.
And his desire to inflict pain on us, I would agree, yes.
And he was a funny sort of guy that way. And he took numbing gel and put it on the end of this fiber optic tube. It was probably the size of maybe a cocktail straw.
I was thinking more like a small finger.
Oh, it's shit. It wasn't that
At least
bad.
that's what it felt like.
It does feel that way.
Bells, Junior.
You have a
That
lot
was-
of there's a whole lot of nerve endings in that part of the
Sweet
body.
Yes, that was not fun.
But it was so you got a cocktail straw sort of flexible fiber optic scope, and he put numbing gel on the end of it and then just jammed it in my urethra through
Which
my
It takes 20 minutes for numbing gel to work.
thank you. Oh,
Give
Suck
myself a bell.
Son of a bitch. How many am I down now?
that is correct. Well, I've got
You
one.
won
and
last
Tacey's got
time.
one.
That's the truth. Damn it.
But yes, it does absolutely nothing.
Yeah.
It made them feel better.
Yeah.
Doesn't make us feel better. And to the point that I was in so much discomfort. Now, again, Scott and I have talked about this before, but we don't want to dissuade anyone from having this done.
No.
So it wasn't that bad, but it's fun to talk about how bad it was. But it was bad enough that when I left that place, I backed into somebody's car and I got out, and it was like I couldn't wait to get home because I felt like my urethra had razor blades, was lined with razor blades. And I got out of the car, looked real quick, no damage, took off home. And then about an hour later, I get a knock on the door. And it's this police officer saying, "Did you hit somebody in the parking lot?" It's like, yeah, but there wasn't any damage. Looking at that later, I think that somebody saw me hit the car, get out and look at the thing and then take off. And then they told the person whose car it was what my license plate was. And then they went, "Oh, yay, I can get this other light on the wrong side fixed by this guy's insurance company because it was there's no way in hell I could have hit that side of their car with my car."
No.
But anyway, but I digress. And then it was totally normal. So in men younger than 40 without risk factors, and the risk factors would be history of cancer, any sort of known problem of your urogenital system, or any bleeding disorders. And in men with no associated symptoms whatsoever, which was me, hematospermia is self-limited, requires no further evaluation. Every once in a while, they'll put you on an antibiotic just to make you feel like you're doing something. And, many cases are attributable to sexually transmitted infections, but that wasn't my case. So it was just one. It was
Yeah,
one and done.
right.
Well, I mean, Tacey's
I was playing.
Tacey's pretty clean.
Yes.
But anyway, so yeah. Now, if you have fevers or chills or
That's
bone
different,
pain or anything like that, then you got to do something else. And but yeah, it's not that common, but it ain't that uncommon
No,
either.
no, coming here. And to answer our other question, are the testicles sensitive? The answer would be yes.
Yes. Okay.
Yes,
well.
Yes. Just to
Give
get
thyself a bell.
Oh, there you go.
just to clear that up for if there's anybody.
Well, I think
wondering.
what she was saying is if you got kicked in the balls, would it make your sperm bleed? And the answer to that is most of the time not.
Most of them no.
Now, if you get kicked in the balls, it could give you epididymitis.
And that sucks.
That sucks. But
Yeah.
that's why I had to stop bodybuilding because I started getting epididymitis, and every time I would lift and do the Valsalva maneuver,
Those 12-ounce curls were killing
Shit,
him, weren't
go
they?
fuck yourself. I'm taking a bell away.
Oh, no, don't debell me. Oh,
Stupid mind.
dang it.
Stupid.
Dang it.
No, dude, I used to go with this guy. His name was Gary Latta. He and I were both ham radio operators. He was in Durham, North Carolina. And we would compete against each other at the gym. And we got to where we were curling the max on the dang machine, dude, and that's when we had to go to free weights. So I've got that. Listen, I know you
You
can't
got the
tell. looking at me
24-inch
now.
gun pythons like Hulk Hogan.
There's pictures of me holding my nieces up by my guns.
And
you
they
know?
weighed 8 pounds each. at the
Oh,
time.
Exactly.
okay, all right.
Okay, so we know there's no part of the story that, except for that could be true. 2 ham radio operators that lift weights, not a chance.
Okay,
one maybe, but
Fair.
not 2.
And
There's
we-
just no
Oh,
way.
he
And in
deserves
the
a
same
bell
in
for
the same
that.
city.
Yep,
No
lost another
chance.
bell. Now you're
Dang
minus
it.
one.
Oh man, you can't go back to my last show. You can only take away from future shows.
Okay, fair. All right.
I won last show. Fair
That
and
was
square.
hilarious.
That is true, though. We were an anomaly.
Hey, but true now. But true, weightlifting can certainly cause
Yeah.
bleeding down there. And
Well, it certainly caused epididymitis for me. So, I just got this horrible pain like I'd been kicked in the balls.
oh, it's awful.
Every time I went in and started lifting, So, anyway.
Awful.
There's this guy at the gym
I'm going to
today.
start lifting again just so I can prove it because I should pump back up pretty quickly, given that it's only been 50 years since I did this.
Let me tell you about this guy at the gym today.
Okay. Yeah.
He was doing dead weights,
Yeah.
way too much weight. He couldn't handle it.
Yeah.
Spitting everywhere in the middle of a pandemic.
Spitting.
Yeah, like,
Oh, you mean he was getting up there? And...
yeah, spitting. And it was going
Oh,
miles.
jeez.
So I probably have COVID now.
And this is a chain.
Oh goodness sakes.
And this is a chain place. It's not some
No,
crappy
it's not
gym.
a chain. I don't think
Oh, it
it's-
isn't?
No.
Okay. Well, all right. I don't want to say the name.
No.
That's pretty gross. Listen, if you're gonna deadlift and stuff, stay within your weight,
And don't spit everywhere.
and then you won't spit.
yeah.
You know. God, have you ever seen these monster dudes in the Olympics?
Oh,
doing that?
gosh.
It's amazing.
It's incredible. I love watching the strongest man in the universe contest where they carry those damn boulders and stuff.
Oh,
around.
yeah.
It's like holy
Yeah, or
moly.
logs.
or logs or whatever. Who cares? It's
Yeah.
like
Cars.
I couldn't move one with a fork truck. You know.
No, I know.
Holy.
It's amazing. It's like those guys are different species from
Yeah.